So hello everyone, welcome to this webinar on how to prepare for the NEET super specialty for critical care. For those who do not know me, I'm Dr. Riddhi. I'm the critical care faculty from Marrow. So I was one of the first batch from All India Institute of Medical Sciences, Delhi. I did my DM from there. I also did my MD in anesthesia prior to that, and I've completed my ADIC. And currently I'm working as a critical care faculty consultant in critical care. So will mainly take around 10 to 15 minutes to just give you a brief idea, something that I've already covered before as well, as to how we should be preparing or how should we go about or what is a good way to prepare for NEET super specialty. And then maybe after that, you can type in your questions in the chat box, or if you want to voice it out, you can do that as well. And we'll take the major part, we'll be discussing whatever queries you have. So first part, maybe 10-15 minutes, we'll just give you a brief idea as to how to prepare for Marrow, using Marrow or otherwise to prepare for critical care, right? So obviously, this is not new. Last year, in October, we had this notification from NV, which kind of uh, declared that from now on, critical care would become a separate paper, meaning that all the questions would exclusively be from critical care medicine, and it will not be a part of the medicine subgroup. So now, previously, questions would be mainly coming from medicine. So maybe disadvantage for people who are coming from other specialties like anesthesia or emergency medicine. But now the entire question bank or the questions are going to be from critical care. And this happened last year as well. So if you go into some of the interviews of the toppers whom I interviewed last year, they will tell you that almost all the questions were from either medicine, emergency medicine, some anesthesia, but again related to critical care. So kind of core critical care that is going to be asked in this exam. So that is what you basically need to be well prepared for when you are preparing for some of these exams. So kind of the preparation becomes almost same to your INI or INI SS. So eligibility, obviously at this stage, if you're preparing seriously, you would be knowing whether you're eligible or not. So basically MD, DNB, anesthesia, medicine, chest respiratory medicine, as well as DNB emergency medicine, and MDs are the ones who are eligible for critical care super specialty or subspecialty. So the question is that why should you subscribe to Marrow or why should you take Marrow? Personally, I feel Marrow is an extremely good resource. Not obviously, I have my own conflicts of interest because I am a critical care faculty here. But what Marrow definitely offers is that it provides you about 85 plus hours of critical care lectures with notes, and obviously we are building it up with every week. So almost 85 hours of critical care lectures with notes. Along with that, you'll have, and now the notes are even available in a hardbound form if you want to get it from Marrow. Along with that, we have an excellent question bank, which again, another very efficient team. They're working on it and they're trying to make it more and more robust. And we have this monthly mock tests or grand tests, as you call them. Not just critical care, you'll also get access, especially if you have like subscribed to the medicine branch, then or the medicine as part of critical care medicine as part of the medicine subscription, then you'll get access to other Marrow lectures of medicine and allied specialties. Similarly, if you are from anesthesia background and you've taken the anesthesia residency, then obviously it allows you to get access to other anesthesia notes as well as anesthesia lectures. So in a way, it kind of covers you. So not just you can listen to critical care notes, but especially if you are like wanting to listen to any other faculty from Marrow, for example, if you want to listen to cardiac, if you want to listen to liver, from any other faculty, if you want to listen to biostatistics or even pulmo, you can always go back and you can actually listen to any of these lectures as well. But obviously critical care, if you're preparing for NEET SS for critical care has to be your main focus. So I wouldn't advise like you deviate too much, but again, obviously if you're interested, you can go ahead, and if you want to just clear your doubts in one of the particular topics, or you want to learn about that topic in much more detail, then that is something that Marrow will also offer you. And obviously, it is a very easy to access Marrow app. Like I have it in my own phone, and obviously, if you are a Marrow subscriber, you can download it from App Store or Play Store, depending on your operating system, and it will be like it's quite easy to use. And I'll just show you, like if you see over here, this is a Marrow app, and obviously, once you're subscribed to the Marrow app, you have all these MCQs that you can solve over there, right? And along with that, like if you go into this particular critical care medicine module, you'll have access to the lectures as well. And whenever you click on some of these lectures, what you'll have is that you'll also have the notes underneath. So you can actually scroll through the notes as well, or you can just listen to the lectures and make your own notes. What I usually suggest to the students, if they have adequate amount of time, is that they make their own notes, right? So that is essentially what Marrow will be offering you in terms of your resources, lectures, notes, along with that MCQs to solve, as well as you'll have access to the like all these MCQs would be there. And along with that, you will have monthly grand tests, which will be useful for you to gauge your level of preparation, right? So that is what basically Marrow will offer you. So what are the topics that are covered in some of these lectures? So basically, we have almost covered all the different domains of critical care: respiratory, cardiac, endocrine, nephro, obstetrics, GI critical care. Recently, I took some lectures on burns as well, neurocritical care, hematological issues, and recently I've taken two lectures on the recall questions from last year's INI as well as NEET SS, which are going to be uploaded soon, I suppose. So essentially, you kind of get a wholesome idea. 85 plus hours of lectures, to be honest, is enough for the exam. It is more than enough. You are able to cover all those lectures. You'll be able to cover most of the topics that the questions are going to come from. Obviously, as a student, I often get, as a faculty, a lot of students often they ask me like they want to read a textbook, and which is fine because they want to gain some deeper understanding of the subject, and they often ask which textbook should I choose. So these are some good textbooks of critical care. O's manual. I haven't studied O's manual. I didn't ever consult it, but there are a lot of toppers as well. A lot of my colleagues and batchmates they had studied O's manual when they were preparing, so I presume it's a very good resource. I studied Finks. That was when I was doing my residency. That is also a very good textbook for critical care. Arvind Rupe again is a very detailed textbook, so something I wouldn't recommend you to study when you are preparing for the exam, but rather something that you should do when you are doing your residency, right? But otherwise, it's a very elaborate and a very detailed textbook and an excellent textbook for critical care. Oxford textbook, again, it is a very good resource. If you like, a lot of students, they also consult it as well from time to time. But again, if you're not interested in studying any of these textbooks, it's absolutely fine. You can just focus on Manual lectures, notes, and along with that, you have to just choose one textbook. What I would suggest is the Washington Manual of Critical Care. This is something that I also studied when I was a resident as well as when I was preparing for it. It is an excellent handbook. It is not very detailed, but at the same time, even though it looks so quite small, it actually carries a lot of information. All the scoring systems, all the small details you'll be covered in this textbook. So obviously, you can depend on your Marrow lectures and the Marrow notes, and along with that, if you're just going through this. And the Washington Manual, the advantage with the Washington Manual is that it also doesn't take a lot of time to revise. So it's kind of something that is easily achievable, especially maybe when you are faced with shortage of time. So if I have to choose one, I would just probably choose a Washington Manual. But again, if you have more time, if you have time for more detailed preparation, or if you have been reading critical care for a long time, then maybe you can choose a bigger textbook as well. But generally, your Marrow lectures notes will suffice. It will mostly cover all the topics. And obviously, along with that, if you do the MCQs and the GTs, then maybe some minor dacula which might be there will be covered on those lectures as well as notes, right? So that is about the textbooks. There are other resources as well, and these are some of the free resources, used resources that are available over the internet. For example, Deranged Physiology is basically run by people from Australia, and it's a very nice resource, especially for people who are preparing for the FICCM exams as well. And then it kind of elaborates small topics in a very nice way. Life in the Fast Lane for GCG, especially MCRIT is there, along with the Internet Book of Critical Care. There is Bottom Line, which is again free to use website for trials. If you are interested, somebody who's interested in trials, you can always look it up. Up to date Medscape are again online resources that you will probably be well aware of at this point of time. Up to date again is a paid subscription unless you're working in a hospital and your institution has access to it. If you are willing to buy it, then you can go ahead. But even if you do not have up to date access, doesn't mean anything. The rest of the resources that I told you, the Marrow is more than enough. And anyways, I always consult up to date when I'm taking up a lecture. So most of those updates would be covered anyways. Medscape again, like it's a free access in your mobile, something that obviously you can check from time to time. For X-rays, a lot of residents ask me about where to study X-rays from. Obviously, there are a lot of lectures in I think Marrow app as well. But again, radiology masterclass online resources there. There is for ultrasound, there is coreultrasound.com. So these are basically some of the free to use resources that if you're interested, and these are not resources that you're going to probably depend on even when you are preparing for your NEET SS or your exam, but even when you eventually move into critical care and these are some resources that you can keep on going back and forth even during your residency. So these are excellent free to use resources that are available on the internet. A lot of YouTube videos as well, but the problem with the YouTube videos is that they're not well organized. So in a way, Marrow will give you everything in a well organized format that is very easy for you to cover before your exams. Obviously, in terms of MCQs, Marrow question bank is ever expanding, and it's a very robust question bank that we have right now, along with the kind tests. There are a few other MCQ books as well that, especially the ones who are preparing for these exams, they consult from time to time. Like Bennington is there, Lobas. There's another MCQ book. There are OSCE's Intensive Care Medicine. There are Indian MCQ books as well. So those are things that maybe once you are done with these MCQs and GTs, and if you want some more exposure to MCQs or you want to test your preparation, you should consult. It is very important to understand that just watching the lectures or just watching just revising the notes is not going to crack the exam for you. For that, you need to do MCQs, because doing MCQs is the only way you can know how you are applying that knowledge. So any entrance exam is all about application as well, not just about your reading part, as well as how you connect the dots, right? And only when you solve MCQs will you be able to know whether you are being able to apply your knowledge properly. And obviously, MCQs will kind of help you in your time management as well, especially when you are attending some of the strength tests. So, means personally, I would very strongly suggest that not just notes and this thing, but you also take a portion of your day for uh, solving some of the MCQs or revising these MCQs from time to time. Even when you're doing the MCQs, what is a good idea is to actually make some notes from the explanations as well, so that later on, even if you're not able to revise some of those MCQs, or at least the ones you didn't get right in the first instance, so when you look at those notes, it kind of helps in your revision part as well. So I think that is more than enough. If you're able to even do some of these, it's more than enough for the exam. Obviously, during my course in like now I have been associated with Maro for more than 3 years or close to 3 years now. And obviously, I have been interviewing the toppers from time to time. And last year, NEET SS was one which was in the newer format, in which we were asked questions only from critical care. So obviously, when I interviewed some of the previous toppers, these were some of the things that they suggested, which I found was quite interesting and thought I would share with you. Obviously, you can go back in YouTube and watch those videos as well. But basically, what they said was that attending the grant test was quite useful for them, especially that helped with their time management, right? So time, because in NEET SS, sometimes there are a lot of questions which are clinical. So clinical questions, even reading through them sometimes takes a lot of time. So just from a time management perspective, attending the grant test is very important. Time management or getting used to solving all those MCQs in a particular time period is also very important. There are people who worked in very good ICUs, and for them, that was also always an X factor. Again, that is something that I cannot control. But obviously, if you are working in an ICU, what happens is that you see a lot of these cases which are being discussed, maybe with your faculty. And some of these cases, they will give you some sort of a passive knowledge, and that is always very helpful for exams. So somebody who's working in the ICU, they will always have that X factor. Again, that is something that is not always controllable. We have had great toppers even from emergency medicine as well. People who may not be regularly posted in ICU. So just shows that even if you are not having that kind of a backup, but you're willing to kind of grind, go through the notes, go through the lectures, make your notes, and go through the MCQs. Even without that, you can get a very, very good rank. So obviously, if you are working, that might add to your preparation as well. Scoring systems are asked. So that is something again that you need to mug up. Personally, I'm not a very big fan of scoring systems, because I think that is all mugging up business. But again, these are things that are asked. Maybe when you're going through any of these topics, like maybe when you're going through acute liver failure, you think about King's College or any of the scoring systems that are used, pancreatitis, Ranson's criteria, or bicep scoring system, and so on. So these are some of the things. And last year, especially in NEET SS, a lot of questions were asked from toxicology as well. Toxicology, we have quite a few number of modules in our critical care lectures. So that is something that I would strongly suggest that you cover. There might be questions like that are completely off in terms of toxicology, some very rare metals or something. So even if you don't get it right, it's fine. But at least you should be able to get the common ones, right? Like paracetamol and that usual stuff, organophosphorus. Those things you shouldn't be getting wrong. So that is important. And to have the basic knowledge about toxicology is very important when you're preparing for some of those exams, right? So obviously, people ask how to prepare. Obviously, again, the preparation or how much effort you put into that preparation or how much you're able to do it will depend on what kind of work you're doing, how much time you have in your hands. And for each of us, the situation is going to be different. For somebody who might be working, and then along that with that preparing, that person might be having less time in hands. For somebody maybe who has taken a break, sitting at home and studying, might have more time, right? So again, that will actually determine how much detail your preparation can be. Also, how much time you have in your hands prior to the exams. For somebody who has started preparing maybe 6 months early, they might be able to do a much more detailed preparation. But generally, what I would suggest is that even if you have 2 to 3 months, what you should do is you should watch the videos. If you have no knowledge of critical care, then maybe you should study something like Paul Marino to just have a basic knowledge about what critical care is. But if you have some basic knowledge, then just watch the videos, make the notes. If you're not able to make the notes, at least get the Marrow notes, try to underline them, try to know what exactly you want to remember from those notes for the exams so that it becomes easier for you to revise. Solve the MCQs and attend the grand tests. That is also very important. Just watching videos, making notes, you'll never get a good rank, right? Because now what you have to understand is that now NEET SS, because for the last few years, there were problems with filling up those seats. Now they've kind of made the percentile to be zero, right? So essentially, it is not. It has kind of become a qualifying exam. Like you are going to get a seat anyways if you write the exam. So most of the people you are going to get a seat. But again, what matters is to get a good rank so that you can get a good seat in an institute of your choice. So that's why having a better rank always matters in these exams. Maybe you're going to get a seat, but whether you're going to get a good seat is what is more important, right? So obviously solve the MCQs, attend the grand tests, and revise, revise, and revise. So for any of these entrance exams, from what I have experienced, because I through my career, is that like clearing all of these exams, you do not need to be super intelligent or anything. What you only need to do is have a strategy and to work on that strategy. And a good part of that strategy is a boarding thing that you have to keep on reading something and revising it from time to time, because that is the only way you can reinforce that knowledge inside your brain. So revision is very important. Just studying a new topic till the day of the exam, what happens is that our brain is not able to consolidate on that information. And finally, when you are faced with an MCQ from that topic, you do not tend to remember what will be the correct answer in that case. So obviously, time to time, you have to revise. Revision is very important as much as you're reading new topics or solving MCQs. So just try to keep it simple. Do not try to confuse it too much. Mostly, if you have put in the efforts, you have done all of some of these things in the last 2 3 months, you'll be well prepared and have confidence in the day of the exam. You're going to do well, no doubt about it, if you have done some of these things properly. If not, if you are even not successful this time around, if you keep on doing these things, you are going to be successful the next time around. There is no rocket science is that, and definitely you're going to get a good rank. So just conclude this by saying, but there's this famous quote by Bruce Lee, who says that he does not fear the man who has practiced 10,000 kicks once, but if he is a man who has practiced the same kick 10,000 times. So any entrance exam, and this kind of applies to any entrance exam, it's kind of boring, but it also means that if somebody keeps on practicing the same thing, revising the same thing, you get more and more strong with it. So that is something that you should keep in your mind. That is something you should be doing, right? So I really don't think there's much to add. This is something that I keep on telling every time. Obviously, the pattern of preparing for any exam will not change from year to year. So maybe even next year, if I take a class, I'll probably going to harp on the same topics. But that is it. All the best to all of you. And if you have any questions right now, you can just, I'll just stop sharing the screen. So if you have any questions right now, you can just type it in the chat box, or you can just um, speak out. So I'll just try taking some of these questions that are already there in the chat box. Um, so I think Dr. Suman is asking, I'm from medicine background, so how to cover anesthesia for critical care NEET SS? So to be honest with you, Suman, I would suggest that you do not worry too much about anesthesia for NEET SS. The reason being is that like what you would be expected to answer is questions that there's some overlap between anesthesia and critical care. If they're asking like very core anesthesia questions, it's very difficult for somebody from anesthesia to actually get it right. And I don't want you to just run behind some uh, MCQs that are very, very anesthesia heavy. So you can even like I have taken a lecture on NEET SS recall as well. And you can go through those. You'll find some questions that are kind of overlapping between anesthesia and critical care. And those are things that you'll be expected to know at this point of time. So just focus on those things. Don't worry about covering anesthesia. You're not going to get anywhere with that. Just focus on your strengths, right? Uh, if you're starting now, will it be possible to clear INA? What should be the preparation plan for the interview? So I would say, like I usually take first focus on the theory. The theory carries a good 80 marks. The interview is only 20 marks, right? And generally for people who clear the theory, I usually take a lecture prior to the uh, interviews, just to let you know what the pattern is. But generally for INISS as well as critical linked as well, the basic preparation strategy should be the same, because both the exams, they are going to ask you questions from critical care. Last INISS, I was a bit disappointed because there was a lot of questions a few questions from anesthesia as well, something that I was discussed in one of these recall videos that they're going to put up shortly. So you can maybe consult that, especially if you're from non-anesthesia background. But again, the bulk of the questions are going to be from critical care, 2 3 questions from anesthesia, core anesthesia. Even if you do not get it right, it's fine. Basic preparation strategy is not going to be different, be it for NEET SS or INISS, given the pattern of the exam is going to be exactly the same. For interviews, usually I take a lecture once the theory part is over and once the theory results are out. So maybe that you can attend that when you do eventually clear or qualify for the interview. I don't want you to uh, confuse you too much with the interview, they usually follow a fixed pattern. It's usually held by EMS Delhi. So they're doing it every year. They do follow a fixed pattern. So don't worry about it at this point of time. Try to focus on the theory aspect or trying to create the step one, right, of stage one. Yeah. So Yogesh has already pointed out, we'll have a stage two interview session once the dates are announced, right? So don't worry about that. When will be the NEET SS in 2026? I do not know that, to be honest with you. This is something that obviously you have to find out from your friends or from MB. Like, we do not decide on the dates of the exam. And anesthesia topics, high yield topics, is nothing like high yield. Like, I cannot really, because anesthesia is a big subject, right? So you cannot just come like uh, condense a subject into like just high yield topics. But what I can do, or what I have already done, is that whatever anesthesia MCQs that were asked in the previous years, I have covered it in the INI SS record and the NEET SS record. So maybe you can watch those two videos. That will give you at least an idea about what those topics were. So that will give you an idea. But again, anesthesia is a big subject, so I cannot just condense it into a 1 hour lecture and say that. Maybe for the airway part I can do, but for the other topics, like, it cannot be condensed into a 1 hour lecture or something. But I can just tell them, because I also don't know what they're going to ask in case do ask. But what I would suggest is that you focus on those aspects where there is a overlap. For example, if they ask you about muscle relaxant of choice in patients with CKD, and this is something like you are supposed to answer, because in acute SS trial they use atragudem or cisatragudem, and simply because the drug would undergo Hoffman elimination, right? So because it is not organ dependent, the elimination is not organ dependent. So these are the kind of questions that might be asked. They might look anesthesia questions, but again, these are questions that even as a medicine graduate, you should be expected to answer, because there's some overlap, right? If they ask you some pure anesthesia questions, again, I really don't think that is right also, but again, that is very difficult to cover. There's somebody who was asking, Dr. Manjeet, that I've just started preparing. So can you suggest some important topics on which I have to focus? So important topics, like the core topics, definitely have to focus, like sepsis, ARDS, antibiotics, nutrition, hemodynamic monitoring, toxicology, respiratory critical care, cardio critical care. So these are the questions they're going to ask you anyways. So these are the ones that you should try to cover, because there are going to be a lot of MCQs. And that's why you should always go and watch the INISS and MCQ videos, because that will give an idea where the questions are coming from. So once you see, then try to cover those. And then maybe the smaller topics, the rarer topics, you can do it later. But at least try to cover the major topics first, and then try to go into the rarer topics. So that, I think, would be a good strategy. So in the last 2 months, then what was the strategy to complete? So in the last 2 months, again, depends how much time you have. If you have enough time, you're sitting at home, then watch the Marrow videos, revise the lectures, solve MCQs. 2 months, and then along with that, if you want to study a textbook, do not go into a big textbook. Just study the Washington Manual. That is an ideal textbook if you have less time. Please make this video available offline. Obviously, it will be available. Biostatistics to be read for NEET SSR. Last time, no statistics questions. Again, this is very difficult to predict, right? Biostatistics, whether they're going to ask or not, nobody knows. It depends, right? If you want to watch 15 videos and if you have that amount of time, then go ahead and watch the Marrow app. If you do not have time, don't worry about biostatistics. Generally, last time NEET SS, nobody has biostatistics. In the AIMS stage 2 interview, sometimes they'll ask you something about the biostatistics. So in that case, if you have time, you can go and watch those. But 15 videos, it's going to take some time. So don't worry about 1 or 2 questions which are going to come, possibly. A maximum 1 or 2 questions that can come. Focus about things that are going to come in bulk, right? So if you have the time, definitely you can consult Marrow, the videos that are there, and watch the biostatistics portion. But again, you need to decide which is going to be your priority. Any upcoming NEET SS GT plan? So Yogesh,
We have, yes, so for since June, I think we have June, July, every month we have one GT. It'll be there till the exam.
right. Right. So that is, I think that should suffice. Then I think Dr. Tenzin is asked regarding like she's from anesthesia background. So do I need to study medicine? No, you do not need to study medicine. There's no need to study medicine. They are not going to ask you anything from medicine. They're only going to ask you critical care. That is for sure. If you look at last year's exam, they might ask you something from emergency medicine. But emergency medicine and medicine there and critical care, they tend to overlap, right? Both are related to acute case specialties. So do not need to study anything from core medicine. That part is no longer there because that they changed the format last year, right? What about PEDS critical care medicine? PEDS critical care medicine, I think that's a completely separate thing, right? Pediatric critical care. So for that, you need to probably subscribe to the pediatric faculties. And I'm not covering pediatric critical care. I'm just talking about adult critical care here. So for PEDS, or if you're asking about whether questions are going to be asked for PEDS critical care, they're not going to be asked for PEDS in the exam. Nobody's going to ask you PEDS critical care in the exam, if that is your question. They might ask you about burns or something, and like because the calorie requirement in burns and all those things are different in pediatrics or the protein requirement. So those I have covered in one of the lectures, which is again going to be uploaded maybe by the next week. But other than that, they're not going to ask you PEDS critical care questions, right? Important topics in PEDS critical care medicine, I have no idea. For the adult critical care part, you do not need to know anything. But again, PEDS critical care, I'm not the PEDS critical care faculty. So for that, maybe you need to get in touch with the PEDS critical care faculty at Pyro. So Jogesh, if you can just guide
Yes,
Dr. Belinda regarding that.
yes.
PEDS critical, yeah. Yeah. Um, and then, is it possible to buy only the question bank for critical care? Somebody's asking.
No, sir, it's not possible. So,
No, it's not possible. I've joined the anesthesia. Level is asking, join the anesthesia program. I could find the recall videos in them. Can you add them? Yeah, we'll add them. Don't worry. Because I recorded them only last week. They kind of go through post-production editing. So they're going to be added soon. Don't worry about that. I have a doubt in INISS. They give AIMS rank, general rank. How do they decide? Is there anything like the opt for AIMS and PGI in the application? But there's no specification while applying for AIMS PGI. But I announced qualified rank. How do they shortlist for AIMS interview? Look, I do not have an answer to that. The reason is that when I appeared for AIMS at that time, there was no INI. There was only the AIMS exam. AIMS would be taking the exam and they would just have a merit list. So there were 3 or 4 seats. That's all. I don't know how they do it now. So maybe if you have any seniors who is already doing or already cleared, or you can even contact the previous toppers. I think Yogesh can help you on that. Maybe contact the previous toppers, how they do the counseling portion and all those things. I'm really not. Is 2 months enough for a medical background person by covering recalls and doing by covering the PYQ and recalls and doing MCQ? Is it enough? Look, I it depends like what kind of background knowledge you have in critical care. If you're somebody who's working in ICU who has some strong, good knowledge in critical care, then maybe it will be easier for you to cover the notes and the MCQs and to watch the videos. But again, if you're starting from scratch, if you do not have any prior ICU experience, then it's going to be a bit more difficult to cover everything in 2 months. But again, like if you have only 2 months and you want to just sit for the exam, then just try to focus on the notes, the lectures, and the MCQs and the grand tests. Do not try to look beyond that. Do not try to confuse your preparation. Because in 2 months, these are the maximum things that you can do, even if you're sitting at home and studying. And then just try to have an attempt and see how it goes. If not, then maybe you can go for a detailed plan from next time onwards. I think Dr. Nishant is asking that he just completed anesthesia 3-year residency program. Is it possible to get a good rank in the exam? Obviously, it is possible to get a good rank in the exam, depending on what you want to do, subspecialty or super specialty in. Because you've not clearly mentioned it, but I would assume that if you want to do it in critical care, again, it depends on which hospital you did your DNB from, whether you had some good exposure in critical care. The resource is there. You have to take care of the resource. If you're planning for critical care, I can definitely say if you have like 2 months, if you have some basic critical care knowledge, then just go ahead, do this, whatever Marrow has to offer. And definitely it is possible. Absolutely possible. There are people who have done it in a shorter time. So there's no reason that it's not possible. The formulas to memorize, they asked ideal body weight last year. So there are unlimited formulas on critical care, but the ones I would suggest, like as you already mentioned, ideal body weight, because that is very important for a nutrition perspective. Predicted body weight, especially for your ARDS ventilation, right? Then you need to maybe know the formulas for creatinine clearance, the Cochrane formulas. Maybe you need to have an idea about some of this Stewart Benedict's equation that is used for calculating how much of resting energy expenditure you give them. Cochrane formula for creatine clearance. So these are some of these formulas that come on the top of my head. Obviously, there are a lot of other scoring systems as well that also you probably need to cover. And maybe it is a good idea to actually have them in form of notes, because these are things that are very volatile, things that are not easy to remember unless you are revising them prior to the exam. So please repeat the important topics again. So I think the important topics, again, very difficult to predict, but you should focus on the core critical care topics. So the core critical care topics would be sepsis, would be nutrition, would be ARDS, would be respiratory critical care, like pneumonias, ARDS, pulmonary embolism. There might be questions from obstetric critical care. There might be questions from cardiac as well as nephrocritical care. And obviously in the Indian context, there might be questions from tropical fever as well and toxicology. So these I would think are the major topics. Also, obviously, you should have a look at the recall videos, which are going to be uploaded soon. So that will give you an idea as to what are the areas from where questions are being asked, right? Even trauma, questions might be asked from trauma as well. Trauma and toxicology were two areas from which a lot of questions were asked in last year's NEET SS. Can you please make a video on calorie requirements calculation, please? So that has already been, if you look at the nutrition video, that is already there. So calorie requirement, if I just to reiterate, so when you are doing a calorie requirement calculation, basically there are many ways to do it. Once you do it on the basis of your um, ideal body weight. So generally, if you do not use any of these formulas like your Stewart Benedict equation, you just start with 20 to 25 kilocalories. For obese individuals, we start with a slightly lower kilocalorie requirement or kilocalorie per kg body weight. Otherwise, for the formula that you use is a Stewart Benedict's equation, but none of these are gold standards. They all overestimate or underestimate the amount of calories that you want to give a patient. So the gold standard is an indirect calorimetry, which does it based on your respiratory quotient. There are some ventilators nowadays which are available, which actually have that facility for indirect calorimetry based on your carbon dioxide elimination and your oxygen consumption. They actually give you resting energy expenditure. And that is indirect calorimetry, which is considered to be the gold standard. If you do not have it, you can just do a rough thing, 20 to 25 kilocalories per kg of ideal body weight. Or you can apply the Stewart Benedict's equation, which is based on height, weight, BMI, and a few other variables, right? So that is, and that has been covered in the lecture on nutrition. You can go ahead and watch that lecture on nutrition. That is covered there. If there's anybody else who has any other questions, you can just type it in the chat box. Maybe so again, this is critical care grant tests are not streamed in anesthesia critical care program, I think.
I
For
think
critical care,
it's there, sir. It's there in both courses. I'll just check and then I'll connect with the user and then see if there's an issue.
yeah.
It
So
should be
if
there
they're
in
not
both courses, sir.
okay, if that is not there, then you can get in touch with Yogesh or anybody from the Maro team. They're going to help you, right? So again, how are pico line and litco lines different? So pico lines basically though both basically based on the principles of kind of transpulmonary thermodilation, right? So one basically in one you from what I remember is that in the lithium indicator dilution technique you inject a diluted solution of lithium and then you basically see the change in concentration of the lithium over time, and that helps you in drawing that curve from which you calculate the cardiac output. For transpulmonary of the pico line, basically what you do is that you are transpulmonary thermodilution in which you basically inject some I don't know, but probably you need a central line and an arterial line. And from the central line, you do an injected, and the arterial line kind of detects the change in temperature or something like that, from what I can remember. So that is how you basically, and that also again generates a curve. The details I also actually forgot, but again, if you go into that hemodynamic monitoring module, then you'll be able to. That is completely covered quite in detail. So that is something that you can look into. Um, is there anything else that you guys want to ask?
Yes, sir. I think those have been the majority of the questions.
Okay. So thank you so much, guys. I wish you all the best. If you want to have any other doubts that maybe that comes from time to time, you can reach me out, um, uh, like on LinkedIn or some social media. If you have any other further questions, obviously I might not be able to solve the MCQs, but if you have any gross things that you are worried about in terms of your preparation, you can just contact me on LinkedIn or any social media, and be happy to answer. Thank you guys, and I wish you all the best. 2 months is enough for preparation. Don't worry about it. Just you give it your best go. And who knows, you might end up having a very good rate. So don't worry about the time. Whatever time you have, use it well. That is it. So thank you guys. All the best to all of you. I wish you all the best, and I hope you get a good rank and you're able to pursue your desired specialty in a institute of your choice. Thank you once again for joining in. See you.